Hey. Right, good morning everybody. We are here to focus our attention on improving services and improving lives for people with a learning disability. And we're very pleased to be here this morning.
Yeah.
Hang on a second, what do I point it at?
Okay.
I'll have to get used to both things. So thank you for inviting us here this morning. My name is Hazel Watson. I work for NHS England. I'm the clinical lead on the Learning Disability Programme. And I'm here this morning with my colleague, Gavin Harding, who is also part of our team. And he will explain his role and what it is that we do as a team as we go forward.
Yeah. Okay.
So we want to do a number of things in our presentation this morning. We want to talk to you about the national programme. And the national programme, as you know, is a joint programme between health and social care. A lot of the emphasis is on the health service and what we are doing to improve services for people. The health service cannot do that unless it does it in partnership with social care. And the impact of social care and working in partnership with social care colleagues will absolutely dictate the success or otherwise of the work that we are trying to do. We want to talk a bit about employing people with a learning disability and or autism. We want to talk a bit about our work as the Improving Health and Quality team, and then a bit about the wider Transforming Care programme. And one of the things that we are hugely aware of as a programme is that actually we can talk ourselves into a knot, as I'm sure a number of people in this room will recognise. We can talk about strategic transformation, and we can talk about all sorts of things associated with services. And the really important bit for us is how we don't get wrapped up in that, but actually remember that while we have to do all of that, this is about improving people's lives, and this is about improving the services to individuals. And the comments that Andrea's just made about remembering that actually this is about individuals and their families is really important. And it's a real trick for us to pull. You know, we're working nationally, we've got numbers of documents and policy documents, and we talk in fantastically flowery language. So we really have to be careful between all of us as partners that we don't get stuck in that place, and that we remember that what we're doing is about improving services and improving lives for people with a learning disability. And our national programme really only has two aims. We know that people with a learning disability die earlier than people who aren't labelled with a learning disability. It's a national statistic that's been with us for many years, and actually it's been with us for many years, so we have to do something about that. We have to do something about the health inequalities that we've got in this country for people with a learning disability. And although that is very largely a health responsibility, social care plays an enormous role in that, and we'll talk a bit about that. And the second thing that we're doing is reducing the number of people who are in hospital inappropriately, who don't need to be there, and changing the shape of our services so that we have fewer hospital places and more robust community services, such that we can support people and their families to live the lives that they want to and not end up inappropriately in hospital, or if for some reason they do have to go into hospital, to make sure that we actually get people out faster than we are currently doing. So the programme is a wide programme. It's quite complex. We're doing an awful lot, but actually we only have two goals in mind, and everything we're doing is about achieving those two objectives. And one of the most important things that we're doing as part of the programme, which really helps us remember that this is about individuals and families, is working with learning disability advisors. So we have employed 5 people as part of the NHS England programme. We employ 3 people specifically to work with us as part of the Learning Disability programme. And these are full-time contracts, full-time members of our team. Gavin is one, and he's going to talk to you now about his role and the role of his colleagues and how that helps us do what we need to do.
Yeah, it's good to be back in York and North Yorkshire as well, because this is where I started my career as a self-advocate. So it's York and North Yorkshire's fault, Hazel, where I am telling you now. Thank you, Ralph, for that. Yep. We employ people with learning disabilities and autism. Our jobs came out of a discussion when I was chair of the National Forum, because we said, well, actually, if you want people with learning disabilities to be taken seriously, then employ us. Because we said people in the NHS see people with learning disabilities as people they care for and support. And because I've been in the assessment and treatment unit myself, I said, the way health staff treat people, how are you going to get respect if you don't give us a job properly and be part of your team? So we had a discussion with Norman Lamb and Simon Stevens and Jane Cummins from NHS England and the National Forum for People with Learning Disabilities and the organisation Change. We challenged them to actually say employ people with learning disabilities, and that's what's happened. So there are now 5 people with learning disabilities and autism working in the learning disability programme. And I work as one of the learning disability advisors. And we actually got lead jobs as well, because we take leading roles on leading things as well in our roles. And there's 2 people in the engagement team. And I was the first person to be employed by NHS England last year. So, to be proud of working for NHS England, working for NHS England representing people with learning disabilities is a big honour, because I haven't forgotten that it's families and self-advocates where the voices need to be heard from, and we're always constantly reminding the NHS England of this and actually getting them engaged in people with learning disabilities and family carers. Because some people saw the image of people in NHS England sat in Big Quarry House and not actually connecting with anybody, or Skipton House. And some people weren't, and it wasn't always easy, but we're getting there together. And we're changing that image of NHS England. It is important and worth all the effort, and we make a big difference to the part of the programme and other parts of NHS England, because we're saying you need to include people with learning disabilities, families and autism in that programme. If you're going to write a policy, then you need to go out of there and consult with people. And the people in the local authorities and health as well, because they're the ones who work on the front line. We also need to keep it real, and we also know what it's like to have with a learning disability. Because we keep reminding NHS England and social care is not the health and social care model, it's a person's personal model. And it should be around that person. And Ralph kept saying that in York as well, it's around the person. Because that's what it's about. It's not about what health and social care model is. It's around that person's needs, and that's what we keep reminding people of doing. And we also think it's also that NHS and social care is not just their responsibility, it's the voluntary sector and the providers. And it's working outside that box of health and social care. If people are in crisis, then we should be going to people like CAB, Safe Its Finances, someone landing in an assessment and treatment unit. That's where people should be directed, not treated in a hospital bed. And that's where some of the times the challenges are. And we bring new ways of looking at things, and we work all together and make things better. So this is my team who I work with, David Gill and Cal Shaw. David Gill is part-time and works for Rotherham Speak Up, but Cal's full-time. And we also run transforming care masterclasses around the region, and the North of England NHS team have agreed to pay for them this time, and we're offering masterclasses to local authorities and saying we'll run them for self-advocates, family carers and professionals. And we do them around different themes, because we've already done one in the Northwest, and they've been successful. And we're also doing one in Hull shortly, a masterclass, and that's around people with community learning disability teams and social work care teams, about looking at what is out there and why should you admit people to an assessment and treatment unit and start looking at different alternatives. So that is on offer for local authorities and CCGs. So if you need to get in touch, we can get in touch with ourselves. And we're working in regions, because I'm responsible for the North of England. So I'm the Transforming Care Lead for the national team, central team for our team, to oversee the North of England. David's the East Midlands and East region, and Carl is the South and London region. And that's our roles. And and certainly the North of England already know I'm around in the NHS team. But this is where we're working together and making sure things are happening as well. The premature mortality review. We're reviewing early deaths this year as well. And that is quite vital, because we've heard loads of horrendous stories about deaths, and we need to work together. It's not just about owned by health or social care, it's owned by everyone, and that's what we should be working towards. But also in annual health checks. Now, the published next week is the CCG's league tables on how many annual health checks are being done. I'm leading that group with Rob Webster, because we've been looking at the CCGs and scoring them on a rating system. Also, reducing the drugs for people with mental health conditions. A lot of people get put on these medication, and sometimes they're over-medicated. But we know some people have to be put on medication, but it's the amount of medication that is put on. And we need to start checking that around the country. And the outgoing ministers already signed that pledge. And also improving the conditions of people that are often affected with people with learning disabilities and epilepsy and diabetes. And getting other programs in NHS to think about what they make more accessible, like the flu jab plan and the National Diabetes Autism. But this is the area where our team works from centrally, and this is about the Transforming Care programme. Because I spent life in an assessment and treatment unit, and it isn't the most pleasant place, and it's hard for people in there, and there's some people who don't need to be in those beds. But we're also looking at why has people been placed in hospital? How long they've been there? Because we are doing a deep dive around the YORKSHIRE and HUMBER area, going through all the units at the moment, asking how long have they been there, why are they there, and who is commissioned them. And we're doing that across every area where YORKSHIRE and HUMBER provide support for people. But we're also helping to get people out of hospital, because it isn't just health and social care. There is other organisations who should be involved, and we should be looking at those alternatives to prevent people going into hospital. But also, I'm particularly looking at the way community nurses and social workers are getting the message, because we need to scale down that message, because at the end of the day they're dealing with the frontline crisis, and then they're submitting it to the psychiatrist who submits it to the commissioner. And we need to get community learning disability nurses and care managers to look at alternatives rather than hospital, and saying, does that person need to go into hospital and request a care and treatment review? We're also looking at what hospital discharge standards need to be in place. Now we're still doing that consultation, and that's on the NHS website. So anybody who wants to go on there, please fill in what you think the hospital discharge standards should be. And also the quality of life in measures in hospital and improving services in the community. But we also need to look at pre-admission standards as well, about how we can stop people going into assessment and treatment units. Because things can be developed in the service. You lot don't get placed in an assessment and treatment unit, so why should people with learning disabilities? So we need to look at those alternatives and put them in place. Thank you.
So as you can hear from Gavin, there is an awful lot going on. As I say, we have two real powerful objectives on the programme. One is around improving health, which Gavin's spoken a bit about, but the bit I want to just focus on for our final few slides is the bit that actually gets the political attention and actually is about how we change services, how we stop using hospital services inappropriately, and how we improve our community services. So I'm sure a number of colleagues in the room will know that last year in February, Simon Stevens stood up on his 2 feet in front of the Public Accounts Committee and committed that the NHS would reduce the number of hospital beds that it uses for people with a learning disability by 50% in the next 5 years. He's subsequently brought that forward to the next 3 years. And I would imagine that people who are involved in learning disability services in this room are either part of or aware of the transforming care partnerships that now exist in every part of England, such that NHS and social care colleagues together are thinking, actually, then how do we do that? What does that mean for us? And what does that mean for the improvements that we've got to make in our local services? So as I say, we've got 48 transforming care partnerships across England now. They cover the whole of England, every part of England. Health and social care colleagues are working together to think how they are locally going to change services, working with people and working with their families to think how can we better provide services for people with a learning disability in our local area. And we have a number of requests as part of that planning. Obviously, we want fewer beds, and that's both in the NHS and in the independent sector. Where we do have beds, we really want them to be of the best possible quality. As Andrea was describing this morning, some of the inpatient services that we have are absolutely fabulous, and some of the inpatient services that we've got, frankly, are not. And as we all know, the standard that we accept is the standard, that we are happy with. So we really have to make sure that if people do need to be in hospital, that the services that they get are as high a quality as they can be. We're asking transforming care partnerships to plan for more personal health budgets, more use of direct payments, more use of integrated commissioning plans. Actually, we need to factor this into people's planning such that we are shifting the system to support people to use personal budgets and direct payments. If that works for people in their family, it doesn't work for everybody, but actually as a position, as a health and social care community, we need to be much, much better at making that offer and supporting people and their families. We're making specific inroads into housing, and we're saying specifically we want to see more people owning their own home, be that in partnership with other agencies, be that through other ways, or be that through their use of their own resources. Specifically as an indicator, as a target for us, we want to see more people owning their own home, such that they're not then subject to the vagaries of all the housing issues that we all know and understand. But where people aren't in a position to do that, we want to see a wider range of housing, wider range of accommodation for people, so that actually for people who are coming out of hospital, the automatic alternative is not just residential care. And we do a lot of thinking, particularly across health and social care, about the relative value of inpatient services and residential care. Institutions aren't just run by the NHS. You can be in an institutional arrangement regardless of who your care provider is, and we need to be very, 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 very mindful of that. Clearly, we want better community support for people and their families, such that services support people to stay with their families, to stay with their communities and not need to go into hospital. And then if they do get into hospital, they get out as soon as they can, so that people can lead the lives that they want to lead. And importantly, we are also holding the Transforming Care Partnerships to account for delivering these plans. So each Transforming Care Partnership has a senior responsible officer and a deputy, usually one's health and one is social care. And we are holding these people to account. You said you would do this. You said you would change this service. You said you would close this unit. You said you would move this. Well, actually, please come back and tell us when you've done it. So we know that we have a significant number of people still in hospital, more than we would like. And I would imagine a number of colleagues in the room have been involved in care and treatment reviews, which is the review system by which we firstly check that the care and treatment of somebody with a learning disability in hospital is safe and as good as it can be. And secondly, to use that review process to facilitate people's discharge, to make sure that the system and the service and the person and their family are planning for that person's discharge. Hospitals are not homes, and we need to make sure that people move. And the care and treatment reviews have led to significant numbers of people being discharged. That is not to say, for those people who follow the numbers in this regard, that we're still not admitting significant numbers of people, because we are. But the information that we're learning from care and treatment reviews about the quality of what's going on and how we can support people to get discharged earlier is absolutely invaluable. And it's invaluable to Transforming Care Partnerships in terms of knowing and understanding what services they should be commissioning for their local people. And also, we know at least 4 hospitals or units have closed as a direct result of care and treatment reviews, of commissioners in particularly, going onto those wards, going onto those units and actually seeing the quality of care that they are responsible for commissioning. And that act by itself has led, as I've said, to 4 hospitals and units closing. We're just saying we're just not commissioning these services anymore. It's just not good enough for people. We've got a significant amount of transformation funding and capital funding so that the system is trying to help and support. What can we do to unstick some of the difficult issues we've got nationally? This is a really complex and complicated system, often too complex, and it's certainly too complex for people and their families. So what can we do to unstick it and shift it? And we know we have masses more to do, and I'm sure this is people in the room who are associated with this will absolutely recognise this. We are still admitting too many people into hospital. So as fast as we're trying to discharge them out the back door, so we are admitting them in the front door, because we don't yet have the community services in place that will do something about that. So the advent of community CTRs has made a massive difference to this, such that if we think somebody's at risk of going into hospital, we use the same review process that says, what can we do differently? Can we stop this admission? Can we work with the person and their family to do something different? And where those community CTRs are in place, they have made an enormous amount of difference to people. We also know that the experience for some people and their families is still poor. In my role in particular in NHS England, I receive the complaint letters, I meet with the families, and we know that the experience for some people and their families is still poor, and we're working on every individual case in every way to try and shift some of that, and we're doing that with a greater or lesser success. We know some plans aren't good enough yet. Some of the Transforming Care plans are fabulous, and they talk about the most innovative, rights-based, individual-focused, person-centred services that we would be proud to see. and some don't. Some talk about shutting inpatient services and building residential care and making it near the 21st century. So for those transforming care plans, we are going back to encourage and support our colleagues to think more creatively and more innovatively. And obviously, plans don't make change, actions do. Planning, tough as it's been, is the easy bit. Actually doing something to shift the system, working with people and their families, is the much more complicated bit, but actually is the thing that makes change for people. Like Andrea, it would be remiss of me to not mention money. It's as much of a difficulty for us as it is for any part of the system, and it is certainly a difficulty for transforming care partnerships who are trying to work to really significantly change the system, where for some transforming care partnerships, all of the money is tied up in the wrong place. And actually we need to unpick all of that, and that is really complicated and really difficult. And we also know that we've got lots still to do to improve our offer in general primary care for people with a learning disability, and in acute hospitals and in specialist care. But essentially this is what we're looking to do. We want to remove the barriers for people just having an ordinary life, and I'm sure colleagues will have seen this slide before. We know what equality looks like. Everybody gets the same. We know what equity is. We make a balance, don't we, so that people have the same opportunities. But actually what we really want to do is to remove the barriers entirely, such that people can live an ordinary life in the way that they want to. So I would just finish coming back to where we started in terms of one of NHS England's role in terms of working with people with a learning disability as full parts of the team. I was going to ask people to put their hand up. I'm not going to do that. But there will be colleagues in the room who are responsible for planning services and working with people and families with a learning disability. And I would ask you to reflect on whether or not and why not do you not employ people with a learning disability as part of that team. And I don't mean paying people fees and expenses for coming to do a bit of co-production or some engagement or some such. The value we get from working with people as partners in our team, as full-time members of our team, I can't tell you changes my practice, changes our thinking, and changes the way we do things. And I would absolutely commend, if we're really serious about inclusion and about changing the way we work, then why would we not be working with and offering full-time paid employed jobs to colleagues with a learning disability? Thank you.
And I just wanted to say one thing. We are also looking at rural areas as well, because we know rural areas are very hard to get across mental health services, and particularly services for people with learning disabilities. But I'm just going to say, I'm one example. I came out of assessment and treatment units. I've gone on to be a counsellor, and last year I was the first mayor with learning disabilities to be elected in the United Kingdom of Selby. So if I can do it, so can everybody else. Thank you. Is there any questions at all? Anybody got any questions?
Hello, I'm Liz Wilson. I'm a family carer here with Inclusion North. It's great to see such a big partnership with NHS England working on transforming care, but I see a really big gap there. There's nothing that involves schools and preschool partners in the partnership, and what I see is that really good, very early support that connects people to their communities and builds really strong relationships and roots has got to be something that in the long term will play a big part in keeping people out of hospitals and living ordinary lives. What are you doing to bring in those early partners?
Okay, thank you. I'll probably take this one. I could not agree with you more. Because of where the programme started, which was absolutely a focus on inpatient hospital services and moving people out, our focus has largely been on adults. And it's taken us longer than it should have done to work out that that's the wrong place to start. And actually, the focus on prevention and early intervention and working with people in their families, as we all know in this room, has a significant impact on the life chances for people. So we are now starting from the top or the bottom, whichever way you look at it, so that DFE and Directors of Children's Services are now part of our plan, and that we are now asking every Transforming Care partnership to include, more than include, to put a focus on the lives and working with education and children's services, and we need to absolutely do the same to reflect that as part of our team. So at the moment, as Gavin said, we have one colleague, David, who works with us specifically on the CAMS agenda and brings his personal experience to that, but I absolutely acknowledge we've got much more to do there.
And the CAMS, we have got the CAMS team who work regionally, and Siobhan and Sarah Jackson are the leads for the north of England, and they've worked in children's services, so they've got a lot of expertise, and anybody who needs help for that can contact Siobhan and Sarah for support on that, to bring the services together, because we know there is gaps out there between transitions and adult services, because a lot of people get caught in the middle.
Yes, just a quick question. You mentioned the transforming care plans and how it's important that they're accountable to other people. Are they public?
If they're not immediately, they soon will be. We have plans, and I'm just thinking, and I'll go and check the website. They should be on the NHS England website, and if they're not, they soon will be. So they will all be publicly available, such that anybody can see what's happening in their own area.
But one thing, because I've looked at these transforming care plans earlier, and one thing is Yorkshire and Humber need to work jointly as well, because North Yorkshire and York are the only authority that was jointly working out of those transforming care plans that we saw. But I'm sure there is others, but it wasn't recognisable. But we need to be jointly working all together as authorities and CCGs.
I would also say that one thing you will see when you read the plans is actually some transforming care partnerships have got really good engagement with people and their families, and many haven't. So again, we're going back to be saying, actually, it's no good us statutory services just planning what we think is important. Unless you're working with people in their families, we're going to come back to you and suggest that you improve what you do. So I'm terribly conscious that we're standing between you and coffee. So I'm going to hand over to Bev to